guys, it's Audra. Welcome to another video. So today's topic is an interesting one and something that I think a lot of people out there could really benefit from. It's the whole idea of fiber and hormones. And we see every single day about how important fiber is for your health, right? Like everybody needs more fiber in their diet. You're not getting enough, the more the better, that type of thing. Which I agree. Fiber is a great thing. You need fiber in your diet for sure. And most people in America today are not getting near enough fiber that they need to. They're suffering from constipation, from hemorrhoids, from diverticulitis, all types of issues. And if they would just increase their fiber a little bit, they wouldn't have those issues. But on the other end of the spectrum, we have the people who are fiber addicted, literally. High fiber, high water content foods that they're getting way too much fiber in their diet, and it's affecting them on a health standpoint whether they realize it or not. I get emails all the time from girls who do consultations with me saying that they're going to the bathroom literally 5 times a day, like sometimes, or 3 times a day, or even twice a day. Maybe if I'm saying that, you're like, well, I go twice a day, or I go 3 times, like aren't you supposed to go after every meal? And some people advise that. I do not advise that based off of what I'm about to tell you today. I think fiber is an awesome thing, but as you all know, my motto is extremes are easy, balance takes practice. And that's with anything in your life. It's not just your diet. It's with your exercise, your relationships, your job, your work, your school, your play, everything. It would be the same thing as if you were exercising. Obviously it's not good to just sit on the couch all day and not do anything. But on the same token, it's not good to go and do hours and hours and hours of exercise every day. We're living in a culture where we think that more is always better, and that's not the case, as we're about to see. So this is going to be very interesting, and this is for men and women alike. So first I'm going to talk about how high fiber diets can really affect the women, and then we'll get to the men. But basically, we all know that fiber is great, right? So I'm going to read a little bit of some studies that have been done. And first talk about how fiber is beneficial for women as far as breast cancer is concerned. So a lot of women out there are afraid of getting breast cancer because they've heard about their estrogen levels getting very high, and then they're going to get breast cancer and they're going to die and all this kind of stuff. So there have been studies that show that a low-fat, high-fiber diet does decrease your chances of getting breast cancer, okay? The reason why is because there is a very, very obvious correlation between high fat and low fiber diets causing breast cancer. I want to read this, and this is talking about high fat, low fiber diets, okay? So epidemiologic evidence has linked diet to breast cancer with the highest cancer rates observed in women who eat a high fat, low fiber diet. There's also substantial information, both clinical and experimental, that implicates estrogen in the etiology of breast cancer. A recent study from our laboratory has shown that diet influences levels of estrogen, and the main mechanism is metabolism of estrogen in the intestine. The intestinal microflora plays a key role in the enterohepatic circulation of estrogens by deconjugating bound estrogens that appear in the bile, thereby permitting the free hormones to be reabsorbed. By suppressing the microflora with antibiotic therapy, fecal estrogens increase and urinary estrogens decrease, changes indicating diminished intestinal reabsorption. A low-fat, high-fiber diet is associated with similar findings, meaning high fecal estrogens and low urinary estrogens. It appears that the microflora plays a key role in the metabolism of female sex hormones. So, I know that's a lot of just blah, 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 but in a roundabout way, what they're basically saying is the lower your fiber is and the higher your fat is, the more likely you are to reabsorb estrogens in your intestinal tract, okay? So what happens is when you eat food, it can either go really, really fast out, or it can sit there for a little while. The longer that it sits, the more estrogens that are going to be reabsorbed back into your body. The quicker that it's out, the more estrogens that are going to leave your body, okay? Obviously, because of this, because there's a big rush out of estrogens of your body, there's a big decrease in your chance of getting breast cancer because there's a huge link between high estrogen and breast cancer. So that's on one end of the spectrum, and you might hear that and you might say, oh my gosh, I need to go high fiber, low fat, all the way, get all these estrogens out of my body, whatever, okay? But again, balance is key. Balance. You do not want to go crazy with this, okay? Because here's why. On the flip side, there is the idea of eating a low-fat, high-fiber diet, which a lot of you, I'm sure, can relate to, and its effects on estrogen levels in women, okay? So, I'm going to read this study. It says, the effect of dietary fiber and fat on serum sex hormones was studied in premenopausal women. After an initial control period during which the diet was very high in fat, having 40% of calories from fat and low in fiber, around 12 grams a day, the amount of fat and fiber were varied in the setting of a metabolic kitchen and carefully monitored meals. So, they take 48 women and they complete 58 protocols. When the diet was changed to a low-fat diet, anywhere from 20 to 25%, which is very significant for a lot of my viewers, their idea of low-fat is 20 to 25%, not 5 to 8 or 10%, okay? That's very, I want to note that. And a high fiber, which is 40 grams a day. Again, their idea of high fiber is 40 grams. How much are you getting a day based off of Chronometer? Probably more than that. And there was significant decreases in concentrations of estrone, estrone sulfate, testosterone, androstenedione, and sex hormone binding globulin, and near significant decreases in estradiol and free estradiol. When interdependent effects were examined, high fiber alone caused a decrease in estradiol and SHBG, which is the sex hormone binding globulin, whereas fat and fiber caused the observed decrease in estrone sulfate. Dietary fat independently influenced the serum concentration of androstenedione, and increased dietary fiber caused a lengthening of the menstrual cycle by 0.72 days and a length of the follicular phase by 0.85 days, okay? This basically was a study of Asian women eating a high-fiber, low-fat diet, and it showed that they were able to lower their estrogen, okay? And obviously it showed that the decrease in estrogen was correlated with a decreased risk of breast cancer, which is a great thing, because in the first study we saw that they had super high levels of estrogen by eating a high-fat, low-fiber diet. But I do want to note a couple of things. Their idea of low-fat, again, was 20 to 25%, and high-fiber was 40 grams a day. And not to mention the whole decrease of estrogen causing a lengthening of the menstrual cycle and a lengthening of the follicular phase by 0.85 days. That's just in a study, you know, that's not like for years and years and years. So imagine doing this, imagine having a super high fiber, low fat diet, like super, super low fat, super, super high fiber for years, what that's going to do for your estrogen levels. You have to find the balance in this, right? Because if you're eating all high fat all the time and you're not getting any fiber, you're going to have too much estrogen. If you're eating all low fat and fiber all the time, you're not going to get enough estrogen, okay? Because you need some estrogen to be reabsorbed back into your body to be healthy. And honestly, this is what has happened to a ton of girls and while they're losing their periods, because they're eating so much fiber and they're not eating enough fat or calories in general, or they're doing too much exercise or whatever it is that they're doing, a combination of things from sleep to stress to whatever. But this is a huge part of it, and they're going to the bathroom all the time and they're excreting all their estrogen. So when you go get a blood test, your doctor's like, what's up with your estrogen? You know, like, what's up with you? Here are some signs and symptoms of having low estrogen. You could have sleep disturbances that can lead to extreme daytime fatigue, inability to focus on tasks, and a sense that you just don't feel right. These disturbances can result from a combination of heart palpitations. I know a lot of people talk about heart palpitations, hot flashes, night sweats, and cold chills. You may notice that you're gaining weight, particularly water weight, while your eyes, your skin, and your vagina are becoming even drier. You may begin to develop joint pain and headaches, and you may be even more prone to broken bones as the calcium is pulled out of your bones and your bones become more brittle. Please go watch my video on female athlete triad. Your sex drive may lower as your estrogen level drops, and you may begin to develop more vaginal and bladder infections. Maybe you have, maybe you're just peeing all the time, and maybe you aren't even drinking that much water, you know, like you have like a urinary tract infection all the time, it seems like. Any combination of these signs and symptoms of low estrogen can lead to severe depression. This is literally who I work with on a day-to-day basis. When you do a consultation with me and you go through the questionnaire and you answer all my questions, basically this is it in a nutshell. This is what a lot of people are dealing with, low estrogen. So you're as you can see, a lot of it is based off of your diet. If you're going to the bathroom all the time, you don't have enough time for your body to reabsorb estrogens. And again, I'm not saying you need to just stop eating fiber, but you've got to find some balance, to throw in some stuff in there that's going to help lower the fiber content a little bit. If you're living off of high fiber, high water foods, and the food's just running straight through, you're stripping your body of estrogen that you need for healthy hormones, healthy reproduction, healthy bone formation, for your own like mental clarity and mental happiness, all because of the food that you're eating. It's all connected. Men do not get off so easily on this either. And this is very interesting as well. And so they put some men on an 8-week low-fat, high-fiber diet. And this is basically what happened in a nutshell. And I've got all of the sources listed in the top, so you can, or in the bottom, I guess, so you can go check these out, read all the sources, do some more research on your own. But after they were put on this 8-week high-fiber, low-fat diet, the conclusion was that metabolic clearance rates of testosterone were not changed, but the production rates for testosterone showed a downward trend while they were on the low-fat diet modulation, okay? Also, it says, we conclude that reduction in dietary fat intake and increasing your fiber results in 12% consistent lowering of circulating androgen levels without changing the clearance, okay? So what does that mean? It means that you are lowering your androgen hormones, your testosterone hormones. Just like the women are lowering their estrogen, which can be a good thing at times, lowering your androgen hormones, you might want to be careful with that, okay? Let's talk about what happens when your androgen levels get too low. And again, I know a lot of you guys are struggling with this. You've emailed me, you talked to me about it. And this might be something you really want to look into and reconsider how much fiber you're eating and how low your fat is. Basically, it's called androgen deficiency, okay? And I'll just read what it is, and then we'll talk about some of the symptoms. Circulating androgens, which are also known as the male sex steroid hormones, have direct effects on diverse physiological and behavioral systems. Androgens affect sexual desire, bone density, muscle mass and strength, adipose tissue distribution, mood, energy, and psychological well-being. There is a well-documented age-related gradual decline in the serum testosterone and androgen concentrations in healthy adult men. Levels start to decrease at age 35 and continue to decrease at a rate of 2% per year. Erectile function is partly dependent upon androgens, which include substances such as DHEA, androstenedione, testosterone, and 4 other androgens. If your androgen levels are low, your diagnosis is androgen insufficiency syndrome, okay? So some symptoms would include decrease in sexual activity, loss of libido, erectile dysfunction, poor intensity and decrease in volume of ejaculation, irritability, nervousness, generalized weakness, osteoporosis, and decrease of body hair and abdominal obesity, or you store most of your fat in your stomach. In early childhood, some possible symptoms would be the penis and the testes do not grow to the expected size. You have failure to go through full normal puberty, and you have poor development of facial, body, or pubic hair. Okay, so that would be for children. So it doesn't give an age here, but obviously if you've really been through maybe an eating disorder, you're eating a whole lot of fiber and not a lot of fat during this time in your life, then you might be having those symptoms. So for early teenage years, like when you would be going through puberty, some of the symptoms would be poor muscle development, your voice does not deepen, you have a poor growth, like your height doesn't really surge upward like it should. You have maybe a little bit of breast development. You have mood changes, which are low or irritability, poor concentration, low energy, reduced muscle strength, increased body fat, longer time to recover from exercise. And then as you get into adulthood, you would have decreased libido. You would have difficulty getting and keeping an erection, low semen volume, reduced beard or body hair growth, breast development, hot flashes or sweats, osteoporosis, mood changes, poor concentration, easily fatigued, poor muscle strength. Sorry, that's a lot of information. And again, you can go check this out. But this is very, 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 very interesting and I think important. And I think a lot of people need to know about this. It seems that there's like this, like everyone loves the idea of fiber. Everyone loves the idea of, you know, eating super healthy and everything. And I'm not against eating healthy. I'm not saying that at all. But you can be so healthy that you're unhealthy. And I'm all about balance, guys. Like, you have to find a balance here. If you're going to the bathroom way too much and you're just excreting all of your estrogen, or in this case, your androgen for men, you're going to have issues. And how do you know it? Well, you're going to lose your period. You're going to start having bone issues. You're not going to have a sex drive. You might be having increased body fat for men. You know, there's a ton of stuff that can happen, but you don't want to play around with this, specifically when you are younger, okay? This is not the time to be putting your body through jacking up your hormones. This is the time to let your hormones fully develop. You're going to be paying for that for the rest of your life. So, you know, if you need any help with this or whatever, or, you know, email me. I would love to help you out. You can email me. It's thisgirlaudra@gmail.com. But I just think this is really important. Back off the fiber a lot. Increase your fat. Live your life. Do not get caught up in diets. Do not get caught up in what everybody else is telling you to do. Live your life, okay? Be set free from this. Go have fun. Go live your life. You know, do some more research on this. Make your own decisions, obviously. But there's huge correlations. There's studies that have been done. So just be careful with this, you know, and that's about it. If you like this video, please give it a thumbs up. Ask me any questions or comments below, and I will see you guys next time.